Flu season has started early and could be one of the worst in years. The virus has already reached an epidemic level. It's widespread in 36 states, and so far 15 children have died because of the flu. The biggest problem, one of the most common strains of the virus, H3N2, mutated, and that means this season's flu vaccine is less effective than it was before. Since October 1st, more than 95% of the people hospitalized with the flu were infected with this new strain that has been identified. Dr. Lolita McDavid joins me now. She's a pediatrician at University Hospitals in Cleveland. Good morning to you, doctor. If you haven't gotten a flu shot, should you still get it even though it's mutated now?
Yes, you should get it. The mutation means that it's not going to cover the H3N2, but there are still other viruses out there that cause influenza, and you do want to be protected against those.
Now, the H3N2 strain that I was just talking about has been linked to harsh flu seasons in the past. Why is that? Flu season typically peaks in late January and early February, but we're seeing it much earlier than normal.
Yeah, I think we haven't gotten to the peak yet. In 1 week, we went from 13 to 22 states being severely affected by the influenza epidemic, and they're calling it an epidemic. And so I think we have to just know that, and you still should get a flu shot. Any child over 6 months should get immunized, and in particular, children, pregnant women, people with chronic conditions like asthma and heart disease and diabetes, and people over 65. We're seeing that people over 65 are being severely affected this year.
Doctor, we said that it's appearing a little bit earlier than normal. When can we expect this to peak? And also, what other measures can people take to protect themselves from the flu beyond the vaccination?
Well, I don't know that we can predict when it's going to peak. I mean, part of the issue with the H3N2 was they didn't realize that that was going to be a serious element this year until last March, and by that time it was too late to get it into the vaccine that was being developed. So I really think that what people need to do is the preventative kind of things. Number one, wash your hands, wash your hands, wash your hands. And you want to do a 20-second hand wash, not 20-minute, 20-second hand wash. Sing something like Happy Birthday or Yankee Doodle or something that takes you 20 seconds. An alternative are sanitizers, but hand sanitizers give people a false sense of security. You don't get under the nails, you don't get in the cuticles. It's not really the same thing. People particularly just kind of put it on the palms of their hands. You want to wash your hands often. You want to disinfect surfaces that may get germs on them. Quite honestly, I don't shake hands with people. I do what I tell my little patients. I call it giving dap. I go, there are four times more germs on the palm of your hand than on your little fist bump. Right. So if you got to do something, do the fist bump. I've got people in my church, when they pass the peace, they know, just give me a little dap. I'm not going to shake your hand. Doctor, doesn't mean I don't love you.
Doctor, let me give you the virtual fist bump there. Thank you very much for that. We're sorry we're a little bit out of time, but I certainly appreciate that. Dr. Lolita McDavid with that. Sure, all of our viewers will heed the doctor's calls there. Now on to 2 West Virginia police officers who are recovering after being ambushed and shot during a traffic stop.